The David Pakman Show at davidpakman.com.
Welcome back to the show. A gay man was arrested at a hospital in Missouri this week when he refused to leave the bedside of his partner, who he had power of attorney with. And now a restraining order is preventing him from any type of visitation. Roger Gorley told WDAF that even though he has power of attorney to handle his partner's affairs, a family member asked him to leave when he showed up at Research Medical Center in Kansas City, Missouri. Gorley said he refused to leave his partner's bedside and that security put him in handcuffs and escorted him from the building. He says, "I was not recognized as being the husband. I wasn't recognized as being the partner." He said the nurse refused to even confirm that he had power of attorney. She just said, he says she didn't even bother to look it up to check into it. So there's a couple of issues here. One is that this is just a blatant problem with the system we have today with equality. This is not actual equality. The idea that the family asked for him to leave is what some people are calling a mitigating factor. In other words, yes, he has power of attorney, and that he could legally enforce having recognized. But if the family is asking for him to leave, then the hospital has to make some kind of decision. Now, the issue is, if he was the husband, would it be taken more seriously, right? In other words, was there some kind of implicit discrimination there where the hospital says, well, he has power of attorney, but he's not the husband. Therefore, if a family member wants him to go, we will escort him out. Wherever you fall on the minutia, this is a huge problem. This should not happen. And we should really be looking, the hospital has been very clear that they do not discriminate based on sexual orientation. The allegation is there about the nurse. What's going on with the family that this is what they're asking for?
Strange stuff. I mean, if you have power of attorney, the hospital should recognize that.
But the argument would be power of attorney is for decision-making, not necessarily visitation. I don't agree with this argument. I don't agree with it at all. I'm just saying.
That may be. I mean, obviously, it sounds like there are several issues here going on with the family, the hospital, and
these issues aren't isolated, right?
Yeah.
I mean, fundamentalist religious organizations are using healthcare as a lot of their ground game for equality, right? Looking at pharmacists and the idea of giving medication to a partner who is not legally the husband, for example, in a gay couple. They're looking at, as we know with contraception, they're using that to inject religion into how healthcare is administered. And Natan, when it comes to marriage equality, healthcare is also being used as a wedge. We can't even hear Natan today, yeah.
Yeah, I totally agree. I just don't get this thing about the nurses and the hospital not recognizing that this guy had power of attorney. Like,
right.
What is the normal procedure, and why wasn't it able to be followed easily in this case?
If that isn't a true allegation, why is it not? Why was it not looked up? The thing that's not being covered in any of these news articles about this, and maybe it's because I don't know the condition of his partner who is in the hospital. Maybe he's not able to make a statement about this, or he just doesn't care to. But how does the guy in the hospital feel about this? Has anybody asked him? I've not heard any reporting, and I'm sure there may be medical reasons why we're not hearing from him. But does anybody care how he feels about this? Does the family member who asked for his partner to leave, does that person know what the actual patient wants? It's very concerning.
It seems like, unless this story is more complicated than we see, there's got to be a lot of conflict going on between this guy and his family.
I can only imagine.
Yeah.